I'd like now to turn the podium over to the Supervising District Attorney Patrick Vanier, who will moderate our first panel entitled Setting the Stage, Latest National Trends on Marijuana Impact by State.
So I'd like at this time to invite Clarke, Ravi, Channell, Alison, Wassall, Freng, and John Redman to come up to the stage. In planning this event, Dr. Nelson and I discussed sort of the best way in which to open this event. We have so many speakers from such a diverse array of backgrounds and specialists in a variety of different areas as it pertains to marijuana. We felt that the best way of beginning this conference was to set the stage and invite speakers who have been tracking and analyzing data as it pertains to marijuana. The high-intensity drug trafficking areas, or HIDTA programs, specifically in states where legalization of marijuana has already occurred, seem to be the best way and the best speakers to focus on how legalization of marijuana has impacted those states. They are ground zero for marijuana legalization, and they have been the states where they've experimented and they've already seen results on increased access and consumption of marijuana. So these representatives are all from various HIDTA initiatives. The HIDTA program was created by Congress in 1988 under the direction of the White House Office of Drug Control Policy. The HIDTA programs support and fund over 737 initiatives. Some of these initiatives and programs include data collection, intelligence and information sharing, drug use, prevention, education, and drug treatment initiatives, enforcement initiatives comprising multi-agency investigations, interdiction, and prosecution. We're very fortunate today to have these representatives because they have been on the front line. They have been collecting data on increased access to marijuana in their respective states over the last several years. Clarke from Rocky Mountain HIDTA will be our first presenter on this panel. She is an intelligence analyst from the Rocky Mountain HIDTA. And I'm going to ask her to share her work prior to and after Amendment 64, Colorado's legalization proposition, went into effect. And I ask her to tell you what has changed from before January of 2014 until now, and give us an overview of what Colorado has learned so far. Yes, we do.
Okay. Well, can everyone hear me? Is that loud now? No. Can do it like a rock star. I'm not opposed to that.
Should be on.
Like that's better? Alright, so we are doing this wrong. Okay, so just a brief explanation. Like Patrick said, I am Clarke. I am an analyst with Rocky Mountain HIDTA. Colorado is kind of a ground zero for all of this legalization. Rocky Mountain HIDTA is, as Patrick was getting to, a part of a law enforcement group. We do bring federal, state, and local law enforcement together. Our main goal, mission, is to go after the biggest, baddest drug cartels, money laundering organizations, and dismantle those. That is the main mission of a HIDTA. I put this out there because we put together this information on marijuana strictly as data. None of this is our own. This has all been collected from other sources. We put it together, and the sole purpose is we feel like that the Colorado public, as well as nationwide and worldwide now, deserves to know what's actually happening in Colorado. As a HIDTA, we have a very special operation. We will not tell you any which way to go, especially on certain legalization issues or amendments or anything that comes up, but we do have the ability to tell you exactly what's happening in Colorado, and we don't have to go through any filters. We don't have to go through the governor's office to get approval of anything we say. We collect this data primarily from national and state-based organizations, and we put it together in a comprehensive report with lots of pictures and bullet points, because we know no one likes to have to read through a lot of information, and just really get that information out to the public. That is, as Dr. Stu Nelson was saying, you know, we want this to be a factual-based conference. We want this to be a factual-based study on what's actually happening in Colorado, because unfortunately, the message that comes out of Colorado isn't always the truth. It's not really in Colorado's best interest for this to look like a failure, for a lot of different reasons. Politically, with college students, people don't want to send their students to colleges if they know that there's going to be a wide chance of them using pot, or it's a pot school, or things like that. So again, keep that in mind. All of our reports are available online. We want anyone and everyone to go look through these. This is for the public to be educated. This is for lawmakers and policymakers to look at the data and decide for yourselves what's actually happening. And we source everything we do so that you can go through and see where exactly we pulled that data from. Do it yourself if you'd like to look into it as well. I'm giving just a brief overview right now because tomorrow I get the opportunity to speak to you further on our data and give you more detailed information. I thought maybe just the best way to go through this today was to look at some of the arguments for legalization, what the marijuana industry came to us and said in Colorado, and then just briefly tell you what's actually happening in Colorado. And again, I'll put the report up here so you can all look at it yourselves, download it at any opportunity, but also tomorrow I will fully go through more of the data with you. So first of all, eliminate arrest for possession and sale. I think that's one of the biggest arguments that they make. Sergeant Jim Gerhardt, who's here with me from Thornton Police Department, will speak to you on that tomorrow. In Colorado, we were decriminalized since the 70s. So this was never a huge issue in the first place. This is something that the marijuana industry would say was happening, that people were getting arrested simply for having a joint, things like that. That was not occurring in Colorado in the first place. So it's not occurring now, and it wasn't occurring then. I will say, anecdotally, a lot of our drug task forces are now more tasked with marijuana problems than before. It did not eliminate all these issues for our law enforcement. And again, Sergeant Jim Gerhardt will speak further on that tomorrow. Free up law enforcement resources. No, our task forces, we had a commander that told us he had about 20 individuals, and after legalization, he had to dedicate about 17 of those to marijuana cases. The complaints they were getting, all of the issues that were coming up from the illegal black market that's still going on. All of that is still occurring in Colorado, and it absolutely is not freeing up law enforcement in any way. Reduce traffic fatalities, that has not happened. In the report, the marijuana-related traffic fatalities has increased over 60% since legalization, which actually occurred in Colorado in 2013. We voted it in 2012 in November. It was allowed to be legal as of 2013. Our first retail recreational shops opened in January of 2014. So again, I'll talk about these dates tomorrow, but keep that in mind. This data, as a lot of it is as of our retail, was 2013. No increase in use, even among youth. Thank you. Thank you. This absolutely is not true. First of all, regarding youth, we use a lot of national surveys, the National Survey on Drug Use and Health. It's very comprehensive. It also compares national data to specific statewide data, which is why it's one of our favorites. And it also goes back to the 70s. It's a very reliable survey. The marijuana industry, especially in Colorado and nationwide, will try and discount this survey when they don't like what it says, but when they do like what it says, they will use it. So keep that in mind. But Colorado, as of the last data available, the 2013-2014 data, we are now #1 in the nation for youth use. That's 12 to 17 years old. We've come up from number 14. We've always been a little bit higher than the national average. We were number 14 in the nation before our medical commercialization occurred in Colorado. But as each legalization has occurred, we have increased use. We have moved up to being number 1 in the nation. We are also number 1 in the nation now for college age use. That's 18 to 25, with about over 30% use in college age. And then same year, we're now number 1 in the nation for adult use. So we are leading the nation in all 3 categories, and that is not something we are proud of or wanting to win at all. So use has absolutely increased, and that just makes sense. Again, I'll talk about this tomorrow, but anytime you legalize a substance, the use is going to increase. That's just common sense. Alcohol is our most commonly used substance. We almost have as many people addicted to alcohol as use all illegal drugs combined. That's because it's available, it's legal, and it's out there. As soon as you make anything, any substance more available, use is going to increase. And of course, it's getting to our kids. It's getting in the schools. We see it in the schools every day. Added revenue generated through taxation. Yes, we have had revenue. This past year was over, I can't remember exactly, but it was over $100 million in revenue. However, I will show you tomorrow that still equals 0.5% of our total statewide budget. And the amount of money that we're having to spend to try and regulate this industry, to try and educate kids to not use it, for all these other unforeseen problems that have come up. We're having safety issues on our 16th Street Mall, downtown Denver, that was very popular. We're losing business in our convention center. The marketing firm for Denver put out a report that said that Denver is losing valuable business because the perception of people coming into Colorado is that downtown Denver is dirty, smells terrible, smells like marijuana, and it's unsafe. We've had people say that they have felt safer in downtown New York, in Philadelphia, and Chicago than they do in Denver right now. And that is absolutely something we've never had to deal with before. So yes, there's money coming in, but even the governor's office, the committee for marijuana, they make statements that say you're not going to be able to pave the streets in gold with this marijuana revenue. If you're legalizing it for the revenue, don't do it. It's not the end-all be-all. It doesn't end up saving you. There's so many extra costs that come up with this. And then lastly, use the profits for drug cartels. Again, this has not been the case for us. The black market is thriving in Colorado. It's thriving because of our medical industry. It's thriving because of the retail industry. There's a lot of issues with our regulation. The attempt to regulate illegal activity, it's not happening. And there is so much marijuana that is being created and grown in Colorado and shipped across the country. There's opportunities to become a millionaire just by growing marijuana out of your home and shipping it to the East Coast. So this in no way has eliminated the black market. It has not gotten rid of cartels. It has absolutely provided a thriving environment for illegal activity. I know I'm just touching on general information. Again, tomorrow I will give you more specifics. This is really the important thing I want you to see. Each and every one of you, go online, look this up. You can download this report. It has all of our data, all of our information in that, as well as on this same website is all the previous reports we've done. So this was released last week, and it is the 4th edition of this report, so volume 4. My information's also on there, and I will have it tomorrow and today as well. Feel free and let us know any questions. I hope that's just a little bit of a teaser to get you excited to hear the rest of what's happening in Colorado. Thank you.
Thank you, Ms. Clarke. That's exactly why we wanted to begin the conference this way with this type of information, to give you a sense as we go into the different subtopics of the impact of marijuana in the communities. When we talk about driving under the influence, we talk about fatalities, we talk about youth access. It's these types of reports that provide you with the data, the hard facts that give us an indication from California's perspective of what increased access to marijuana will do to our communities. Next, we have Prevention and Treatment Manager Stephen Freng and Intelligence Analyst Alison Wassall from Northwest HIDTA to discuss their work prior to and after July of 2014 when Washington's legalization initiative went into effect. And they themselves have also been working on and have published a report and have done similar data collection on the impact that Washington's marijuana legalization initiative has had on that state. So I'd like to welcome Stephen Freng and Alison Wassall at this point.
Thank you, Matt. I think one can rightly assume that Alison and I may be the only two folks from Washington State that are here, so we thought we'd take this morning to give you a little background about the Northwest HIDTA and talk in much more detail this afternoon in regard to the impact that commercialization has had in the state. First off, we are 14 counties in Washington State. We were originally designated in 1997 by the Office of National Drug Control Policy. We were 7 counties initially, essentially the eastern counties on Puget Sound and Yakima. Because the collaboration that occurred between the federal, state, and local agencies under the auspices of the HIDTA was very remarkable and very quick in regard to the impacts that we were having around drug trafficking and some of the other related consequences. Our congressional delegation came back after about 3 years and asked if we couldn't expand, and we did indeed double in size to 14 counties that you see there. It's no accident that the counties through which I-5 run from the Canadian border to the Oregon border are part of the Northwest HIDTA. That's essentially how drugs arrive in the state, both from Canada and from the south. And we also don't consider it an accident that Yakima County is part of the Northwest HIDTA because it is one of the principal drug distribution centers in the United States. This map is courtesy of our colleagues at DEA. We have been dealing with this situation in Washington State for many years at this point. We know for a fact that more drugs come west from Yakima to Seattle than east from Seattle to Yakima. Yakima is essentially the principal distribution center for a region that extends throughout the upper Midwest. This is essentially a franchise. The Sinaloa cartel essentially dominates this region, although the Jalisco group is now here and there are some Zeta and some other cartel activities going on in the state. Think of Walgreens, think of a large corporate organization that is very organized, distributes drugs on a routine basis, finds its way into every small town and city in the region, and is thriving. We can essentially thank most of this extensive network, can thank methamphetamine for that, because it was initially a rural phenomenon. It started in small towns like Davenport, like Clarkston, other places in Washington State that are very rural and very isolated, and very quickly became part of the distribution network for the cartels as they began to expand and grow throughout the region. Briefly, the Northwest HIDTA is a little bit unusual in terms of the HIDTA community in the United States in that we have a robust prevention and treatment component. I manage that. It's approximately 20% of the Northwest HIDTA budget. I have support for 10 drug court programs in our 14 counties, for 10 community coalitions or county organizations that are responsible for prevention in their counties. We do much in the way of public education, both in terms of print, electronic, and public speaking. And because I live in such an unbelievably sophisticated data, I'm able to share many resources with my partner agencies at a lot of different levels. I bring this up solely because one of the services we provide is in the Watch Center. We provide a service that my law enforcement colleagues have coined deconfliction, which essentially means in years past, if the Santa Clara PD was undercover in an apartment and the DEA busted in with their weapons drawn, DEA didn't know the Santa Clara was going to be there, Santa Clara didn't know the DEA was coming, and folks got hurt that way. So we now ask all the law enforcement agencies in our region to call us and register what we call critical events. That can be an individual, an address, a license plate, a phone number, any number of different pieces of information in regard or in association with an operation that may be planned by any one of the law enforcement agencies in the region. Once we get that information, we go into all the data we have available to us. And even though the HIDTA has set the stage and fostered collaboration among the federal, state, and local agencies. You still can't go into the DEA office and call up the FBI database. You simply cannot go into ATF and find out what the border patrol is, although we have access to everyone's data. So when we get a critical event, we will go in and find out if any other agency in the region is also interested in that individual, in that address, in that particular license plate, and we connect them. Officer Smith, would you please contact Agent Johnson in regards to the suspect? We have some information indicating that there's some interest on his part as well as yours in regard to the activities associated with this person. We have tracked these. This was our first full year of operation, the mighty year of 1998. As you can see, not much happened in regard to the activity in the Watch Center that year. Cocaine was still ruling the roost. This stuff called methamphetamine was coming down the road, and I think if we had known then what we know now, we may have dealt with that in a much different manner than we ended up dealing with it. But by and large, it was a relatively quiet period of time. However, since that time, I've asked the analysts in the Watch Center to track these calls, and many different things have happened. It's not surprising, of course, that methamphetamine and heroin are leading the pack in this. The interesting part of this graph, however, is to look at the marijuana line. In essence, law enforcement has essentially turned away from marijuana in Washington State and the Northwest HIDTA. It's not an important issue for them in terms of high-level trafficking. There are organizations, obviously, that traffic in more than one drug, and marijuana is almost always part of the inventory. But as a primary interest, as a primary focus of operations, it's not what it was before. And this would indicate what's going on. As you can see, it's a much more robust service these days. We're up over 5,000 critical events a year. Very few anymore are related to marijuana. It's simply not on the radar screen in the manner that it had been before, and we're dealing with some of the consequences of that. So, without any further ado, in regard to the commercialization, at least an overview of commercialization in Washington State, I'd like to turn the microphone over to my colleague, Alison Wassall.
All right. So this is the cover of our report that was actually released in March of this year. I will go into this report in further detail. Chelsea will be speaking on hers tomorrow afternoon. I will be this afternoon going over Washington State specifically, talking about all the impacts that we have seen since our legalization. However, we wanted to start and give you guys a little taste this morning of the history of Washington State legalization from a medical standpoint as well as a recreational standpoint to essentially get us to a point of how did Washington get to the place that it is today with marijuana. So we start back with our medical. Most as the other states here, I'm sure that you all started with medical marijuana in some form or another in your past. So for us as a state, we started in 1998 through Initiative 692. And this essentially set a threshold of a 60-day supply for those qualified patients who were authorized from a physician. That was the only authorization party at that time who could actually issue out those authorizations to patients. This is a very small community of patients with certain conditions, and they were given their 60-day supply. However, that 60-day supply was never defined. What does that mean? What is my 60-day supply in comparison to Steve's, in comparison to Chelsea's? Like, what does that actually mean? So then, in 2007, our state decided that, hey, maybe we should define it. So they did. And it said that we are now allowed 24 ounces of marijuana, which again could be any type of product, and 15 marijuana plants per person. I'm sure most of you have seen pictures of marijuana plants. These aren't these cute little things that sit on your back patio in a ceramic pot. These are trees. Imagine 15 of them. In 2009, our state decided, hey, physicians, yes, you've been giving out all these authorizations. However, we want to increase that pool of who's allowed to hand out those authorizations. So they entered in physician's assistants, nurse practitioners, and naturopaths, and then boom, our entire state was flooded with not only medically authorized patients, but all these different access points around our state. As availability kept growing and growing, a whole bunch of different patients wanted to sit together as well as designated providers and go, hey, let's all just kind of join together and we'll just farm a bunch of marijuana at once. Well, this wasn't actually defined, but it is now known as a collective garden, which I'm sure many of your states have also seen as well. But they were never defined. So then, in 2011, not that long ago, our state finally said that, okay, Your collective garden can be 72 ounces of pot on hand in any type of product form and 45 plants. This, was supposed to be in legislation. This was going to be cut and dry, 45 plants, that's it, no questions asked. However, my collective garden could then butt up against his collective garden, Chelsea's collective garden, and then we just have, these huge grows that we see primarily on our eastern side of the state. But that's just one way that it kind of flourished. So, we also saw these little guys pop up, which are dispensaries. And again, I'm sure that your guys' estates have seen any number of what these businesses end up looking like. So our state last year estimated that we had about 1,300 statewide and 100 alone in the city of Seattle. Since our medical marijuana authors legalization in 1998, only 19% of cities and counties statewide actually had explicit zoning for these businesses. But the kicker, dispensary is actually not defined in any of our medical marijuana laws. These just decided to pop up. It's my collective garden that I was going to add easier access and convenience to my patients because I'm a very caring individual, and then they just opened up shop. Now when you go in these shops, these are the products in which you've seen, and yes, these are all photos straight from our medical marijuana industry, so this is legit, this is what you see. You've got your giant mason jars with a handy dandy little label maker on it, letting you know what you're going to hopefully end up getting. How about a 180 milligram white chocolate raspberry chocolate bar, because that sounds festive, or a Chiba Chew. So anything they can put pot in, they're putting pot in. Or you go to our eastern side of the state, and this is where you see your plywood grows. These are the collective gardens if they're not a storefront. And again, these can be massive trees. I was actually in one last summer, and you just walk in and look up. They're massive. They have just been bred and bred and bred to produce and produce and produce. Yakima County alone, which Steve had mentioned is our kind of hot spot in the state, they've actually pulled 20 pounds off of plants before. This isn't your willy-nilly couple pounds here, couple ounces. I mean, 20 pounds. People are making good. Recreational marijuana. Well, this is what our medical track got us into today. So in 2012, our state legalized recreational use for those 21 and older through Initiative 502 or I-502. That same year, they also said that we are allowed to sell marijuana concentrates. We can produce and manufacture and sell along with usable marijuana products. So our possession limits, or our transaction limits for those 21 years of age or older are 1 ounce of usable marijuana if they want to roll up a joint, 7 grams of concentrate, 16 ounces of infused product in a solid form, or 72 ounces of infused product in a liquid form. And again, those are product examples on the bottom. So you have usable marijuana, you've got your shatter in a cute little Ziploc bag, you've got an edible of a chewy in a Ziploc bag, and then you have your zoots, which is essentially like if you get one of those little Mio things, same concept. If you're already drinking a beverage, add some THC to it, and you're on your way. So, here we go. So, and then with legalization, our state set up a licensing system, and we only have 3 types of licensing options in our state. So first and foremost is your producer. This is your grower. Our state deemed that there are 3 tiers of growing you can do. Tier 1 is up to 2,000 square feet. Tier 2 is 2,000 to 10,000 square feet. And Tier 3 is at 10,000 to 30,000 square feet. And if you look at those pictures, again, which are from licensed facilities in our state, it looks like a Costco of marijuana. I mean, so they're manufacturing it. If Yakima alone in the backyard is being able to pull 20 pounds off of a plant, what are these guys actually being able to produce and manufacture in their own controlled facility? Our second license is a processor. Essentially, this is your manufacturer. This is the one who's essentially making all of your goodies. So you'd have some of the wax oil, you see the production plant, as well as some of the candies or gems or pebbles in which they like to call, that are just being manufactured at those facilities. This is a license that can also be held in combination with a producer. So I can grow it and I can manufacture it all under one roof. Our final type of licensing is a retail establishment. So this is just your storefront. So those 21 years or older can go here, can go buy their product, whatever they would like. And when our state passed legalization in 2012, they said explicitly that statewide we were going to cap our licensing amount at 334 stores. That's it. They based it upon population, jurisdiction size, city size, to pretty much essentially say that Seattle gets this many licenses for retail, Tacoma gets this many, Yakima gets this many, Spokane, so on and so forth. Now, our state went through some very, very, very interesting legislation changes April of 2015, just this last year, which actually rolled out this past July. So we now have an integrated market. So many of you with medical marijuana, there's been lack of solid regulation. There hasn't been very many rules, policy, accountability, responsibility, and defined definitions of what this medical status is. So through Senate Bill 5052, our state decided, okay, we're going to roll in this gray market medical marijuana with our regulated, quote unquote, recreational marijuana system, so they're all under one roof. So now that I can supervise and license and issue out rules, guidance for our medical industry alongside our recreational marijuana industry. In addition, House Bill 2136 changed the taxing structure, the taxing rate, and the disbursements with a newly integrated medical market inside of our recreational market. And finally, House Bill 2000 opened up the doors for federally recognized tribes in our state to sign compacts with our Washington State Liquor and Cannabis Board, which is legit, and then our governor pretty much say that yes, this tribe wants to become involved in either the medical marijuana market or the recreational marijuana market for growing, for producing, or selling the product on their own reservation lands. I know this is probably a really broad, fast, I speak fast, I'm sure most of you have noticed that, but I will be speaking slower this afternoon, kind of going into more detail about where Washington is at specifically. So this is Steve's contact information, my contact information. At the bottom you have a link to our report if you want to look at it. We do have an executive summary if you want to look at it before this afternoon. But we will be going in, again, further detail into this report and essentially saying from this timeline, what is that data in which we've seen, what does our research say, what's the future of Washington State as a whole. Thank you guys for your time. I hope I didn't speak too fast, but we'll see you this afternoon.
Thank you, Ms. Wassall. Thank you, Mr. Freng. So next up, we have intelligence analyst Ravi Channell from Oregon HIDTA. Oregon's Measure 91 was passed in November of 2014 and went into effect last July 2015. Now, 1 year later, Oregon is now tracking and doing a similar project as Colorado HIDTA, Rocky Mountain HIDTA, and Northwest HIDTA is doing. They're still in the process of collecting their data and putting together their report. But Mr. Channell was nice enough to come today to sort of give us an overview of how they're approaching this issue. What are some of their concerns? And so, Mr. Channell, I'll turn the microphone over to you.
Well, thank you. Those of us from Oregon love coming down to California, get full sun. And like Patrick was saying, basically we are right now exploring the planet that these two pioneered. We're exploring the same types of issues that Colorado has seen, that Washington's seeing, and that California is dealing with. So what I'm going to do is take a slightly different approach to this. I want to talk a little bit about how we're developing our report, how we are doing our research, and our collection methodology really for this type of issue, because it is a very multifaceted and complex issue. So we're taking a risk-based approach to this topic. We obviously have to identify the areas of concern, and then we're developing our collection methodology based off of those needs. We're working with our community partners throughout Oregon, so we're going directly to our partners on the compliance side, our partners in healthcare, and trying to get as much primary source information as we can possibly do. Because we know at the end of the day, we want an objective and empirically based piece of research that somebody, as Chelsea said, can recreate should they want to. So what we're doing is taking the Cole Memorandum and using that as a framework for developing our report. And we're taking each one of those areas and bringing it down to the Oregon level so that we can understand how it's tangible to our state. Because at the end of the day, we need a target-centric approach, or what's called a subject-centric approach. So we're using a networked approach to our intelligence collection. So rather than keeping this as some kind of linear, I go, get information, process it, develop a product, and send it back to my stakeholders, we're opening lines of communication and taking a very open and collaborative approach to how we deal with this topic. So in other words, what that means for us is that we're able to garner a lot more information from, for example, our medical marijuana compliance personnel take it, process it, hand it back to them and say, does this look like what you gave us? So far we've actually had a very robust collection since April, and I was brought on in April. We also know too, part of this is that we are just a part of the overall issue in the state. Coming from the law enforcement side, we're just the enforcement component. And at the end of the day, we really need to preserve public health and public safety, which in this threat environment is very challenging. Because as you've seen from my colleagues up here, this is not a simple issue. There are a lot of moving parts. There are a lot of things to consider. There are a lot of claims that the pro-marijuana lobby has made about when this kind of legislation passes, what you will be seeing. So we have a unique area in Oregon. Alison recently had the opportunity to come down and check out what we're doing. And even though Oregon is the smallest state by population on the West Coast, other than Alaska, obviously, we have an abundance of marijuana. We overproduce 3 to 5 times what we would need for domestic consumption in our state. That, as of 2012, was about 150,000 pounds annually. And remember, we're in 2016 now. Those of you who are familiar with the landscape in Northern California and Southern Oregon know why it's called the Emerald Triangle and the state of Jefferson. So we have to think about that grow kind of mentality that happens with growers and stuff like that, where they just produce and produce and produce. We also have a very large medical marijuana community. As of last month, there were about 67,000 registered medical marijuana patients. And we're also dealing with an area, according to the National Surveys on Drug Use and Health, where 1 in 10 Oregonians uses marijuana over the age of 18. So our report methodology is that we have developed a definition and sub-problems for each of our collection requirements. From there, we've done rather extensive literature reviews. I was thanking Marilyn Hustis for the amount of research she's put into this topic, because we basically eaten up half of our hard drive with her publications. And from there, we also run our own analysis. So we're not taking anything at face value. We're recreating every single thing that we see so that we know exactly what we're dealing with. And also documenting our methodology, because I want it possible for any of you to pick up our report and say, hey, I can go do this myself if I want to. So we're trying to create applied intelligence because we want to understand our threat landscape. And we have a unique perspective, because not only am I HIDTA, I'm actually Oregon State Police. So rather than just HIDTA designated counties, I'm able to capture more information and get a comprehensive picture of our entire state's activity. And my Sergeant Patrick Husky will be talking to you a little bit later about the enforcement challenges that we're seeing from the actual boots on the ground perspective. And really, we're taking an analytic approach that I think is slightly unique. We're not only doing the, okay, what is the impact? What was our baseline? But we want to answer the, well, what does that mean kind of questions. So we're looking at relationships between diversion and cost. We're looking at the networks of these different entities who are involved in the marijuana community on both the recreational side and the medical side, so that we can understand the geographic footprint that our state has in relation to the nation. Because at the end of the day, we really want to develop target-centric and subject-specific products that help us isolate our communities of concern and help us make a more informed national discussion about, obviously, a very complex topic. So what we're going to be doing with our report is really narrowing down to looking at cannabis diversion, especially the economic incentive that comes with it as the marijuana moves east. We're looking at impaired driving, which is a highly controversial topic, and there is an abundance of misinformation out there. So we also are trying to understand some of the acute public health effects. I'm sure we're all familiar with the marijuana extraction boom, forgive the pun, that's happening throughout these states. And we're trying to understand, too, any relationship that there is with cultivation and violence. We have some areas in Southern Oregon that are extremely interesting in that regard. Most of all, we're trying to understand, do we have a proper working definition for marijuana crimes? Are we still thinking about this like the dope on the street? Or do we need to start thinking about this in relation to financial crimes, tax evasion, employment fraud, and possible violations of Foreign Corrupt Practices Act? If you're importing marijuana seeds from somewhere abroad, how does that impact state law? And so we're really trying to take that big picture view and understand all of the different moving parts as much as we can. Nonetheless, at the end of the day, we want to give practical recommendations to all of our stakeholders. And our report will be publicly available. We want policymakers, law enforcement, community members on the health side, even the pro-marijuana camp, to read it and see if they get something useful from it. In any case, really thank you for your time, and if you have any questions, there's my contact information.
Thank you, Mr. Channell. And finally, we have Mr. Redman. He is the Director of Demand Reduction for California's HIDTA. Mr. Redman has spent the better part of the last decade studying the trends of this state's consumption of marijuana after the passage of California's Compassionate Use Act in 1996. We asked him to come here today to talk about what he's seen in the past in terms of the proliferation of the retail sale of marijuana and the increased consumption of marijuana since the passage of the Compassionate Use Act in 1996, as well as what he sees in the future with increased access to marijuana if this state goes down the road of legalizing recreational marijuana. Mr. Redman.
Thank you. So there are 4 HIDTAs in California: San Diego, Los Angeles, the Northern California area, which is in San Francisco, based in San Francisco, and then there's the Central Valley HIDTA, which is based out of Sacramento and all the way down past Fresno. I direct demand reduction for all 4, and one of the things that we were asked to do is to take a look at marijuana, the medical marijuana impact in California, and how has that affected certain populations. So I was actually at a conference in Denver about a year and a half ago, and Tom Gorman, the director of the Rocky Mountain HIDTA, was there, and we started to discuss, California, because what you see here is each of these states that have already legalized it for recreational use. Well, if Californians are going to start to take a look at that policy, then shouldn't they be able to look at what the medical marijuana impact has been? So actually Chelsea came out to our HIDTA and kind of instructed us of all of the challenges and hoops that one would have to jump through to get through this. We thought it would take only a few months. It's taken many, many months. And we should, the report is done. The HIDTA directors and their offices are looking over it now. My hope is that it comes out next week. Tomorrow, I'll be talking about our HIDTA impact report, so you'll get to see the data there. I didn't want to spend the time on that, but more kind of what our focus was. It's different than some of the other states that were looking after the fact, after something's already been legalized, what regulations have been put in place, how's that working, how isn't it? What we were looking at is, well, what is the medical marijuana impact, and how much regulation is in it? What has historically the laws been in California, and what populations will it likely affect? So this is an overview. Now, I also wrote a 28-page paper on the history of marijuana legalization over the years, and I've kind of condensed it into one slide. So you don't see your favorite law up there, forgive me. But really what we can do is we can kind of divide it into 2 realms. And it's 1975 to 2009, which I call the passive laws, which was more what some people call decriminalization. I'm not really fond of that term because it means so many things to so many people. But it was a way to diminish the enforcement impact of small amounts of marijuana. And we've had that since 1975. We were one of the first states to do that, and to take small amounts of marijuana, an ounce or less, which was a misdemeanor. Later, that got changed to an infraction. It's not even a criminal offense anymore. There was Prop 215, which we were the first state to legalize marijuana for medicinal purposes. That, at least that's how it's stated. But really, that's not what Prop 215 stated. What it said was, medical marijuana is still illegal, but what you have is an affirmative defense in court. So that if, for whatever reason, people don't determine that that's how you're using it, you can go in state court, in district court, and defend yourself on that, whereas in federal court you can't. It got kind of glossed over that Prop 215 legalized marijuana for medicinal purposes, which it didn't. And then there was Senate Bill 420, which there was a number of things that Senate Bill 420 tried to do in terms of controlling kind of the uncontrollable Prop 215. But the problem with the Senate bill is that if, or proposition, initiative is, if it's voted on by the people, the only way to change that is to go back to a vote of the people. So when you get to the end of the day, Senate Bill 420, and yes, you can choose your bill number. Thanks for getting that. So what happened with Senate Bill 420 was the largest thing it could do was to allow someone to carry an ID card that showed that they were a medical marijuana patient, even though Prop 215 said that you don't have to have it. It could just be by a doctor's recommendation, and that recommendation could be oral. That is the law in California. Senate Bill 420 really didn't do anything to change that, other than to have it more acceptable. What happened in 2009 was, as you heard before, the Ogden memo and the Cole memo. These are two memos by Assistant Attorney Generals in Washington. It was the Ogden memo first that seemed to say that the federal government supported legalization and go ahead and do what you want to do. That was clarified by the Cole memo, not once but twice, I believe, and still confusing. But what happened at that time was that it seemed from a state level that it was kind of an open season. We would start to do more things. And therefore, that's the kind of the active laws that started to happen, where California started actively passing laws where what I call, what they could do is do point of sales. They could actually sell marijuana or dispense it, because you really can't sell it even under the law. So you have a dispensary that's owned by a collective or a cooperative where you're a member, and there's these recommended prices that you donate. I always wondered if you had like $1,000 worth of marijuana you're going to walk out with, if you just donated $1, if you can still do that. I haven't tested that yet, but maybe that's one of the tests we'll do later. But anyway, so anyway, more and more laws in terms of these active laws to commercialize it and have points of sales. Once that happened, when you had 2009, you had an explosion of marijuana dispensaries in Los Angeles. And that was where we first started to see the problems cropping up, pun intended. And so there were almost 1,000 dispensaries in Los Angeles almost overnight. And it created a huge problem that even City Council couldn't ignore. So what were those issues? How did it affect it? Those are the reasons why we wanted to do our HIDTA report. So the HIDTA report is statewide. We wanted to take a look at national data versus California data. We even tried at some points to break it down regionally, which aren't as shocking as you might think, and you'll see that tomorrow. But we tried to take a look at that, look at youth use rates, adult use rates, hospital problems, emergency room mentions, emergency room discharges, DUIs, and then even some, to some lesser extent, some crime statistics. Those are more difficult to do because it's hard to say that, well, general crime is increasing because you have 5 pot stores in the neighborhood. It could be because the economics of the community has changed or whatever. So what we try to do is keep it very focused on crimes that we could relate specifically to marijuana sales, which wasn't much, though we have those as well. What we wanted to take a look at was, what really made sound drug policies. We start to change and look at all of these laws and these policies that we take a look at in California, and we looked at it, and from a World Health Organization model is what is the point of sound drug policy? It's to reduce the use and the harmful effects of drugs on an individual and a community. So if you're going to do that, if you're going to start to have policy, hopefully, and it deals with drugs, you want to reduce, no matter what it is, whether it's alcohol, tobacco, cocaine, methamphetamine, or marijuana. Are the policies that you're presenting, that you're voting on, are they reducing those harmful problems? If we're going to take a look at the public health issues. And it's always bizarre to me when people say, well, alcohol is legal and tobacco is legal, why can't marijuana be legal? And you take a look at a cigarette, which is probably the most god-awful human consumer product ever invented. Kills 500,000 people a year, and we put that up as a litmus test of sound drug policy. Not. Or alcohol, which is the most socially devastating drug that we have out there. On the weekends, with reduced law enforcement dollars, we have 4 black and whites doing northeast San Diego, the whole northeastern division. That's it. And I talked to the law enforcement there, and they said, all we do, John, is spend our entire weekend from Friday night to Sunday afternoon doing nothing but alcohol-related arrests. So, when you take a look and say, well, woohoo, now we can legalize marijuana, let's look at those 2 laws that I just think bizarre. But anyway, having said that, so we're taking a look at also, what changes, what are the issues in prevention? It's attitude, access, advertising. You look at I call them my 3 A's. You take a look at those 3 things, you change those 3 things, and you're going to change use rates in youth. And if prevention is an issue, we're looking at law enforcement, treatment, and prevention. Prevention is an issue. Prevention, by definition, has to be a youth issue. Got to stop it before it starts. And where does it start? So those 3 things change youth use rates. When we took a look at perception, how do kids perceive marijuana? In blue, you have the use rates over the years. It's from 1970 all the way to 2010. In red is the perception of harm or risk in children, of how they perceive marijuana. And you can see as the use rate in red, or the perception of harm or risk in red goes up, use rates go down. As perception of risk goes down, use rates go up. It's a no-brainer. It is a mirror. And so we will change those as we look at our laws. Well, I missed the sign. What was that? 2. Okay, so we're done. Thank you. So, all right. And obviously, alcohol is the most used drug in our society. And by gosh, golly, it is the most abused in youth. Tobacco was for a time, and marijuana was a distant third. Why? Because what adults do is what kids do. How can a child say no to drugs when the adults around them are saying yes? They can. It is strange and crazy to think that will change. The marketing. Now, these products were taken out of the medical marijuana dispensary in Los Angeles. Now, we are a medical marijuana state. We're not full recreational use. So we passed these laws for the dying grandmothers of the world, our MIMAs, so that they can have their medication to stop cancer or HIV/AIDS or whatever. And yet, who are these marketed to? Anyone? I know it's before 10 o'clock or noon.
Kids.
Thank you, kids. Good job. Gold star. So yes, we're already marketing to children. Why? Because the earlier that you can, marijuana is it'll be a corporation of addiction, no matter whether it's alcohol, tobacco, or marijuana. These are corporations that thrive off addiction. The 80-20 rule applies. 80% of their money are off 20% of the users, the addicted. That's where the alcohol industry makes its money, not off of you and I having a glass of beer or wine for dinner, or a celebratory cigar because our neighbor had a baby next door. It's off the 3 pack smokers a day. The earlier you can addict them, the greater chance you have of keeping them for life. The marijuana industry knows that as well. So we're already in California marketing to children. So all of this is having a whole community norm change. And this is Venice Beach, where every 50 feet you can go get your pot. This obviously families walking by where you have a clinician who's probably Harvard medical graduate who is selling and knows everything about the drug abuse. So this is who uses marijuana, and as you'll hear time and time again today, that when the brain is fully developed at 25 years of age, that is where we have to be concerned. And if you notice up here, that's when it starts to drop off very quickly, when people stop using, because that brain is fully formed, and you start making better choices. Those of us who have teenagers or have had teenagers, you know exactly what I'm talking about. We have to be their frontal lobe until age 25. And, but this in red makes up about 70% of the marijuana users. And yet we're passing laws and making laws for 30%, the 30%, negatively impacting the 70%. Makes no sense. And do people understand that? Especially when we understand and we know that the age of onset of marijuana is 12.3 years of age. So, and now 1 in 6 teens become addicted that are just picking up one joint. You had 6 kids in a room, teenagers, picking up one joint, smoking that joint. 1 of those 6 will become addicted. Except that's old data, now it's 1 in 4. Because of the high THC. The impact. You take a look at now, and this is old data, because I did this slide 3 months ago. The new data came out, and it's stunning every time. At the time I presented this slide 3 months ago, it was 19 million people that were current marijuana users in the United States. And if you run the numbers, it's about 2.7 million that meet the criteria of addiction. So why is this important as we take a look at marijuana from a public health standpoint and a drug policy standpoint? Because a small number of a really big gas number, pardon my French, is still a big number. So what we have now is, well, when this slide was done, was about 2.7 million people that meet the criteria of addiction in the United States, and that's the size of Chicago. Unfortunately, that's an old number, and the new numbers have come out, and it's now 4 million today. So when you look at that and the consequences of that, the social consequences, the economic consequences, the public health consequences, we need to take a look at what this means as we start to make choices on our drug policies as we move down the road. If that's what California decides, then so be it, but let's do it off of facts and knowledge. If we're going to accept alcohol socially, understand what it means, tobacco, we understand what that means, let's make informative choices to our drug policies as we take a look at it. So tomorrow, I think I'm the last speaker, and most of you will be gone by then. I know how these conferences work. You know, get the day off, and then you go, yeah, I saw everything. And then you just go to the web and download. But
we are ending early, though.
Yeah. They told me I had 4 hours to speak. So, but I won't be able to, you won't be able to download ours because it hasn't been published yet. Once that happens, then you can. So if you want it, you'll have to come tomorrow. You'll have to come tomorrow to see the data on marijuana. All right, thank you.
Thank you. So Dr. Nelson and I spent many, many hours preparing the agenda for this event, and we agonized over the allotted time we were going to give to each speaker. We've choreographed this entire conference down to the minute, and I'm surprised that we're ahead of schedule right now by 10 minutes. And
I have more time.
Absolutely. So what we were hoping to do is build in some time and have some time to take questions from the audience. And we do have a few attendants in the audience that are here to take questions. So we did provide index cards if you have any questions for our HIDTA representatives. Their research is actually, I think, phenomenal. It has been tested both by the pro-marijuana groups and as well as those opposed to legalization as well, just to vet out their data collection. And so I really, if there is time, we would welcome questions from the audience for them. They will be coming back, and there will be an opportunity to ask them questions later on. If there are no questions, then what we'll do is we'll move on to our next speaker and allow time for her, and hopefully have time for questions at the end of her presentation.
I have a question. Can I ask you a question?
We're taking cards.
Oh, sorry.
Yeah, absolutely. There should be index cards, so. And just send them to the middle. You'll see Josue in the nice gray suit. Thanks. This question, do local law enforcement or HIDTA have access to EPIC data from Fort Bliss, Texas? Anyone want to field that question?
Absolutely.
Yes.
Another question, do you have data or breakdown by ethnicity on adolescent use?
We have some from our state, but not really comprehensive. And again, we like to look at statewide data and also where we can compare it nationally to show where Colorado differs. So no, drilling it down really, really specific is pretty difficult. There is some behavioral health information out there starting in Colorado, but it's just, it's baseline for us.
In our state, and we'll touch into it this afternoon, we'll go over the survey, we have a biannual healthy youth survey that gets administered to 6th, 8th, 10th, and 12th grade students in all districts across our state. And we think it's possible to do that, because when they do the surveys in the fall, so they're doing one currently now, and that data will be available this spring for us to play around with, which is really nerdily exciting. But we can actually build our own metrics into it, so I do believe yes, but we just didn't include it in our initial report, is that that's something we can do further down the road. It could definitely be a possibility for us in Washington, so if anybody else wants that information or wants to touch base with us afterwards, we can try to pull some of that information for you.
I know from the perspective of Oregon, the Oregon Health Authority in January of this year published a very good report dealing with the health side of marijuana and trends they've been seeing. And that particular publication actually does go into demographic composition of users, not just an age group, but cultural composition. I think they even have some information on the socioeconomic status. So it's very comprehensive.
Is there any research on use of individuals who are using while pregnant or going through pregnancy and the effects on brain development?
Yeah. Well, yeah, some of it, I think, probably Marilyn and others are going to talk about that today.
So maybe we can save this question for some of our later speakers.
Bertha, are you talking about that? Yeah.
How does an individual, retail or otherwise, determine how much THC can go into edibles, candies, liquids, etc., that can be safe for consumption?
Washington State is as much as they can.
Yep.
Can you give us some indication on the THC levels and some of the edibles?
They will actually package in a manner that indicates that a dose is 10 milligrams, but the actual product can have several hundred milligrams. And although I don't know about you, I have never eaten one tiny bit of a chocolate chip cookie before. But aside from instructions on the packaging indicating what the THC content is per serving, the number of servings per product is not regulated.
And any of the THC, that's one thing our state also didn't limit, it's just on serving size. So your usable marijuana, any of your product, with the amount of THC going into it, and your concentrates, that THC level is actually unlimited. They can just manufacture until they hit the highest number. The highest usable marijuana that I've seen in our state so far for recreational sale is at 37% for bud alone. And then our highest marijuana concentrate that I found is 94% THC. And as many of you have seen with like dabbing, you take like a teeny tiny little tack nail at 94%. Yeah, it's a
Good night.
no, not a bucket list item for me. Yeah.
The issue on the concentrates, or even just the THC level, a lot of people aren't even regulating that, and also realize that the industry is making most of its money off the highest THC level, right? Same as the alcohol industry. You know, you don't walk by the beer aisle and see a $200 bottle of Sierra Nevada. Just doesn't really happen. But you know, for whiskey, you can have that. The higher the content, the alcohol content, the pricier it can be. No different for marijuana. And in Colorado, when they tried to put some limitations on it, they got huge pushbacks from the industry that didn't allow it. So. So then the question is, well, what is harmful and what is the change? And what we have is some policy, from Holland, for example, where they have changed their laws. So you have hard marijuana and soft marijuana, just like hard drugs, heroin and alcohol. And I don't know if it was arbitrary for them, but they chose above 15% to be hard marijuana, treated like heroin, and below that to be soft. But I talked to Dr. Daryl Inaba, who many of you may know, who was the founder of the Haight-Ashbury Free Clinic, one of the 4 founders in San Francisco, and he said, John, before mid-80s, we didn't have anybody coming into the free clinic addicted to marijuana. But then around the mid-80s, around 1985, all of a sudden we're getting like 25 a week, 100 a month. That was rather stunning to us, and that was back then. And then I took a look at what was the average THC content back in 1985. It was around 4%. So does that mean at 4% you're going to be addicted? No, but you can start to be addicted at much lower levels. That's when we started to see those addictive qualities that met the criteria of addiction with withdrawals and all of that. So, when we're taking a look at 15, 35, 95, and there's just no difference at all in that based on the law, I think we've got a perfect storm brewing.
We've had several delegations from Europe and from Canada come through looking at legalization, and they are astounded that we have no THC limits on our products.
I'll take this last question, and then we'll be segueing into our next presenter. We were asked if this conference is based and intended to be a neutral presentation. Why is there no one from the pro-marijuana camp part of the opening panel? What I want to say is that we have spent the better part of the last 8 months, and it's been a very open and transparent process in terms of inviting speakers to come to this event. We wanted this to be a fact-based event, specifically designed to educate the community on the impact that increased consumption and access to marijuana will bring to Santa Clara County, Silicon Valley, the Bay Area, as well as the entire state of California. And so we wanted individuals who are currently on the front line, actually doing the research, doing the investigation. And if there were people, and there are people out there that are doing that work that lean towards a pro-legalization stance, we were certainly open to inviting those people. And we do have people presenting today and tomorrow that will be talking about the successes of regulatory efforts in medical marijuana, people that will be talking about compassionate use of marijuana at this conference. And so it is certainly our intention for it to be neutral and fact-based, and not individuals who are either advocating for or advocating against a particular ballot measure or a particular piece of legislation that's moving through Sacramento. And that was our intention, and I'm hoping that we've followed that particular mission statement for this event. And so I want to address questions like this when they come up. Again, this is a very open and transparent process. I do think this event will be educational. These individuals on this panel are on the front line, collecting the data, putting out published reports. I've actually seen all 5 of them speak in the past, and I know that the reports that are put out by the HIDTA initiatives at the direction of the Office of White House Drug Control Policy, that their reports have been vetted both by the pro as well as those against marijuana legalization. And so I encourage you to access their reports. They'll make their information available. And certainly during the course of this event, we're trying to make it open for questions. We'll take as many as we can during the event. And those that we can't take during the conference, we will answer those questions via Eventbrite and make the questions and the answers available for all the attendees. Okay, I think that's all the time we have. We're at 9:30 right now, so we're going to segue into our next presenter. I want to thank the representatives from HIDTA for